you can introduce people to your, you can introduce me to your audience too. Ladies and gentlemen, boys and girls, welcome Dr. Larry Burchett, ER doctor, doing more of these from the front lines. Corona. We got a great guest today, Dr. Jessica Sims MD MPH. Dr. Sims was my boss as the director in an emergency department. That's true. And she has climbed the ranks and gone from ER doctor up to, what are you doing now?
I'm doing population health management in managed care. So basically, trying to get people what they need in a organized fashion.
In the system. And so
In
I
the
think
system,
what
enemy
is,
lines.
yeah, I think what's great to have you is your perspective not only as a doctor, so you care about patients on the front line, but then you also know the system. And so I think you can, of all people, have a better than me perspective of big picture wise, public health wise. Are we doing the right things with testing and PPE and social distancing and all of this and all of these models? And I have a lot of questions for you. So I think you're a great person to comment on this and share your thoughts. So thank you for doing this.
Thanks, Larry. No, I'm glad to be here, and I think you're doing some great stuff, and it's good to get more information out there. And you can come work for me anytime, or I'll be working for you before the end of the year.
You can work for me anytime. Well done. Good one.
Yeah. No, you can be my wingman.
You can be my wingman. What is today? Thursday, March 26th. Let me tell you some of the things that I'm seeing in the news. You know, I still work in ERs throughout California, and it hasn't hit a lot of these rural places. Corona has not hit these rural places hard. I think we're seeing cases trickle in and start to show up. I don't know if you've seen this stuff in New York. Some of this stuff is kind of scary, whether that's media or reality. I kind of want your opinion on that. But one particular hospital talking about how they had to have a huge refrigerator truck where they're putting bodies because their morgue is full. And I saw a thing in the Times where they followed around a young physician who was overwhelmed with working in an environment where she didn't feel like there was enough protective equipment. They were worried about running out of ventilators. Is this like exaggerated media hype? Is there truth to it? What's the message? I think this is kind of where we're at right now. A lot of questions in there, but I just wanted your thoughts on where we're at now as we kind of get started with this chat.
Yeah, so I think you hear on Facebook, in the news, different outlets, people who are in pretty difficult, challenging situations.
I'm going to interrupt you for 1 second. Can you center so that you're in the middle? I'm worried that this may cut you off. Sorry.
You good, Jackson? I got my cameraman, my little cameraman back here too.
Let's see your cameraman. Can you show us your cameraman?
Can you
step out and say hi? Who is
it? Say hi.
Who is this guy?
Cheap labor. Except he
cameraman extraordinaire.
Why don't you step in front of this camera and say hi?
I have to hold the camera.
Okay.
Dr. Sims, I want you in the middle of that screen. I don't want you to get cut off. There we go. That's excellent. Okay, sorry.
All right, Jackson, come here.
What, me?
Can you, say hi to Dr. Larry. Come here.
There he is.
Cheap labor cameraman for Facebook Live.
There's the cameraman. Jackson, make sure you're squeezing her for some money out of this. What did you negotiate? How much money are you getting for that filming? Yeah, you need to get something out of it. Some screen time, something.
Larry, I can't remember. Did I give you a lot of bonuses when we were working in that ER together, or was I you tight? I can't remember.
I don't remember why I was terminated, but it was a long time ago. What do you think about where we're at? What are your thoughts?
So I think, there are probably horrific true stories happening in pockets across the country, and those make for sensational news stories and sensational Facebook posts and so forth. Does it mean they're not true? No. I think a lot of those stories probably are true, and they're probably very accurate. When docs on the front line feel extra stressed, they are going to they're going to express it.
Yeah.
And I mean, I think you and I have probably both felt that even in non-pandemic times, where you think, Why don't we have this test available at this time right now? How can this hospital possibly run out of reagent? How can we not have this equipment or that equipment? And that can happen anytime. And then you amplify that with all of the pandemic media stuff and different folks across the country saying they don't have the equipment they need. And then other folks are probably looking around saying, hey, we don't have N95s either. And suddenly it's this big, loud thing, this big gap in our system that is hitting everybody in their face all at once.
Yeah.
So that's what I think that is. It's real, but it's not. I think we're going to be okay at the end of it. I think we're going to go through a very painful period. Some people may end up not surviving this that might have survived otherwise, which is horrible and tragic, but that's something that happens on a daily basis.
I guess like I struggle with, especially doing this stuff and going in the media, and on the one hand, I want to echo a lot of the things that you're saying, which is this is going to be okay, we're going to get through it. But then there's another part of me that when I watch some of these things, I get angry and I'm like, it shouldn't be this way and we should mobilize. And a lot of doctors are saying the same thing. It doesn't feel like things are being done. Like, is there kind of some kind of, not movement, but at least like a political demand where the voice is united and it's saying, no, we're all saying this and we need this. You know what I mean? Like,
yeah.
There's a little bit of emotion and anger that comes with that can be channeled and to the goal that you said, which is as few people, minimizing the deaths out of this. People are gonna die from corona. Are we doing the right things? And if not, what can we do as doctors to help that thing,
Yeah, so how do we harness this energy and this attention and this passion that exists now for something that's actually productive? I think that's the question. How much of it ends up just being noise and wasted energy and driving TV ratings without a true end, and how much can be translated into making sure every hospital in the country and every doctor's office in the country has adequate PPE? How can it be translated into producing enough test kits and testing people and recording it and putting the information out there in a way that it can actually be, it can drive, you can have data-driven decisions. I mean, that's the question. How do you do that? How do you drive that forward?
That is the perfect question, and I can't wait for you to answer it.
Well, I think in some ways it's forums like what you have going on. I mean, when I look at all of my colleagues and friends who have varying sizes of platforms, almost everybody is saying the same thing. Where is the protective equipment, and why are we not promoting and communicating one single approach with one single endpoint? And what is that approach and what is that endpoint? And so the first one, the personal protective equipment, that hits really close to home for healthcare providers. Where is it? What should it be? I know for a fact that Roche is producing something like 400,000 test kits a day. Why aren't we getting testing? I know that there's other industries that are producing a lot of personal protective equipment. How is it being distributed? It's not clear to me, and I keep an ear to the ground. It's not clear to me how it's being distributed and if it's going to where it belongs and how we're deciding where it belongs. So that's a set of questions. And right now we have our leaders basically saying shelter in place so that we can figure things out and buy us some time. But it's easy as a leader, I mean, politically difficult, but logistically it's easy to say, nobody go to school. If you can avoid going to work, don't go to work. All non-essential business is closed because you just get on TV and you say it and a whole bunch of people do it. But what comes next?
Talk to me more about that. I think that's important to, it's an easy message and you get it across when people do it, as opposed to looking at a whole supply chain, starting from manufacturing, paying these guys, and then getting into distribution where you're making sure it gets to the places that need it, and where there's continual feedback from places that need it the most, whether you're talking about, I got it right here. I mean, whether you're talking about these masks, goggles, ventilators, that being harder to make happen. So the other aspect of this question that I kind of want your frank opinion on is, where do you think in all of this we're missing it?
Well, I think if you look at the way healthcare is, and including the medical equipment is set up, it's a capitalist approach to health, right? 17%, nearly 18% of our gross domestic product right now is spent on healthcare. And it's, that is one sector of the economy that will probably do just fine at the end of this, aside from some of these rural places that are going to be stressed pretty significantly. But if you look at what has driven healthcare, it's very supply demand and who can pay for it. And those folks end up getting high level care. You have these hospital chains, the Dignities, the Sutters, the Kaisers that have economies of scale and can really push things, but they're frenemies. They're not quite enemies. They know that we're all in it together, and especially right now, they're definitely not enemies, but they're not exactly friends either. They're competitors with each other. Everywhere from the health insurance company to the medical groups to the hospitals, there's a certain amount of competition, and one can argue, is it a healthy amount of competition? When we're not in a pandemic, I think it's easier to make a stronger argument that it's a healthy competition that drives improvement in all. But when you're dealing with a pandemic, who picks a leader? Who is the leader in all that? And the only natural leader really is the government. And when you talk about the government being the natural leader in this kind of situation, it tends to be at the state level. But then you have states competing with each other for supplies and then driving the cost of those supplies up at the factory level. So it has to be a federal government level drive. And in my opinion, the only entity in the federal government that's capable of doing this well is probably going to be the military. I mean, you look at what they did too.
Interesting.
I mean,
you look at what they did where?
During World War II, what was able to be done. That was the first time penicillin was ever distributed internationally. I mean, penicillin had just basically been developed around that time, and you got all these military guys that are getting various kinds of infections that can be cured with penicillin.
What kinds of infections are you implying they were getting?
Well, that's a whole different show, Larry. We could talk
Things
about
like syphilis and gonorrhea and chlamydia. Okay.
All right, let's stay on task here. You're like my 9-year-old son. As soon as you start talking about,
but go back to this historical example of how the military was able. You were saying that they were able to mass distribute penicillin.
Mass distribute penicillin across multiple continents in the middle of a war.
Wow.
Able to accomplish that.
So you've got that kind of you got that manufacturing and distribution and all of the bureaucratic administration that in that case made that happen.
Yeah, I mean so it's unfortunate we don't have that kind of can-do, get it done command chain that's in place on the civilian side of things. Maybe we will. Maybe that will be developed, in the shadow of this pandemic we're going through. But when you look at what happened, what the military is capable of doing, and you compare that to what is actually happening right now, we probably need a command and control type of thing in terms of manufacturing and distribution of the key elements that are going to be required for this. In my opinion, that's what it's going to take.
Yeah, that's an interesting idea. What do you think about how bad this is going to get, how long this is going to get? With your public health background, I'm curious, I've heard all kinds of different estimations of, well, if we do nothing, 500,000, 1 million Americans could potentially die. Oh, we're going to do the social distancing and the home quarantine, and that's going to make a big difference. We don't want to run out of ventilators in the ICU. From your public health standpoint, what do you think about those numbers and these projections and that kind of thing?
Well, I think the bottom line that you're asking is, how do we get out of this? How does this lockdown end, and what does it look like? And I think there are 3 possibilities that the way we emerge from this lockdown can happen in one of 3 possible ways. One, it's just chaos, and who knows how many people may die either directly from COVID-19 or indirectly because of just the types of chaotic things that happen when there's mass panic and Our systems are stressed. I mean, just not having access to food and water can be an issue for some people. Those kinds of things, where it's either primarily COVID or a secondary cause. So there's the chaotic exit, which is if we just don't systematically or
do nothing.
Basically just let it play its course and keep panicking and freaking out and things happen. I think the second way out of it, which is probably the best way out of it, is a data-driven approach that's driven by very liberal testing, both of the virus and the antibodies. The testing that currently happens, the majority of testing that's happening right now, is for active viral infection. It's, they're doing a PCR, polymerase chain reaction, to amplify the RNA inside cells, and then they're comparing that. I think they're doing ELISA or something to see, is there actual viral RNA present, and if it's there, they say, okay, the virus is present. That's an active infection. That's a positive. And they're checking two different pieces of RNA. If they're both positive, definitely a positive infection. One's positive, they send it to the CDC to figure out. Both negative, it's negative, right? So that's active infection that they're testing for.
So that's the infection. That's the test that most people are like, well, I want to get a test. That's the one that they would do, and it would show if you have an infection right now. If you're
correct.
Okay.
Correct. So what about someone who maybe had an infection 2 weeks ago, or 3 weeks ago, or 4 weeks ago, and
if they would get that test, then it would be
negative.
It would be negative now because the infection's already passed.
Right. But maybe they have immunity. Maybe their isolation serves no purpose, because not only are they not going to be a danger to anyone else, but they are also not at risk for getting the infection themselves. Or if the immunity isn't complete, they're certainly not going to get a serious infection. And if it's a young, healthy person like you or me and my son, if we have antibodies to it, I would say we're pretty safe. We're probably not going to get a severe form of COVID-19, even if immunity is not complete. So,
I think if you've got the antibodies, you are immune, and also important, you're not infectious. You're not going to give it to somebody else. You can go back to your daycare, your nursing home, your hospital, your ER. I would love the chance to demonstrate immunity to this thing so that I can relax going back to work knowing I'm not going to get anybody sick and that I've been through it. I'd love to pay for that test. Where is that test, Jessica?
Well, before we go on to where that test is, what you're saying is generally true, although it's not evidence-based yet that people actually have immunity once exposed. So there's a question, if you end up having a mild version, maybe you have just IgM, which are the immediate antibodies as opposed to long-term antibodies. So people who have mild infections, maybe it doesn't confer actual immunity. So there are some, this becomes very nuanced, but some question about whether an antibody really says you're immune. But I think most people would say if you've got IgG antibodies, so there's going to be nuance to that, but that's the general idea. You hit the nail on the head with the idea of it. In terms of where those tests are coming from, we are in the U.S. There is development of that testing, but it has not been approved or released, and I don't know that it's even ready to be approved and released. So there's the development phase happening de novo in the U.S. Some other countries already have it. China already has it. As a matter of fact, one of the current treatments, it's a experimental treatment, is taking the serum of someone who was known to have been infected and cleared and injecting that serum into an active patient so that the antibodies from
It's almost like an immune system transplant of somebody who has cleared it. You get a match, you transplant their antibodies, and it helps clear that infection. Makes sense.
Yeah, exactly. So that's happening. It's underway. So we talked about the two of the three ways I think we exit this lockdown. One is chaos. Two is active testing and contact tracing, so that we know exactly what we're dealing with and where it is, which gives you a chance to isolate the virus and just let it die off in small pockets. And then the third way, I think over time, and especially when the weather heats up and there's more UV light everywhere, I have a feeling that it will die out.
Is that people have asked me that, and besides saying in the winter, you're breathing in cold air and the cilia and your lungs aren't, moving things through as quickly. Is there truth to this kind of a virus maybe dying out in warmer weather?
Yeah, viruses love to replicate in cool, moist environments. That's not specific to the coronavirus. That is a characteristic of viruses in general. They like moist and cool environments. UV light is one of the most effective virucidal agents that exists. I mean, when Ebola was hitting us and they were trying to figure out ways to kill the Ebola virus wherever it might be found, and liberally bleaching everything, they were thinking about trying to invent machines that could distribute UV light in the dark corners of ambulances where some body fluid might have ended up in some random corner that you can't really. Mm-hmm. But if a flash or prolonged flashes of UV light in these dark corners, that could be a potential way of killing virus. So UV light on its own is a very thing.
I'm like thinking of transforming all of the sun tanning UV lights and just coming up with a fancy way to clean your ambulance.
The suntan salons, maybe they'll start making an argument that they are a essential service.
Yeah, that they're a corona killer. Come in and get the corona UV zapped off of your body.
Right? Or just take a shower.
So what should we do with a lot of the, especially, let's just say this is for physicians that are frustrated and angry and scared, but motivated. How should that be channeled, that energy right now?
There are a couple of organizations, physician organizations, that I think have proven over time that they are kind of the real deal in terms of pushing forward agendas that are good for society and good for healthcare workers and so forth. And there are others that just have large numbers, and so they can move things. But I think as individual docs, you can do your Facebook pages and, educate folks, make sure you yourself are educated and putting out credible information. But collectively,
I think
it's going to be through groups like, I think AAEM is a good one for emergency physicians. The AMA is a good one in general, and they tend to listen to their docs pretty closely. So getting involved in those kinds of organizations, ACEP, CalACEP, they do a lot of work, especially in the state of California. So really kind of figuring out what is an individual, what do you as an individual want to push for? For me personally, personal protective equipment testing. So when these groups
you and I are on the same page. Like I feel like all doctors are saying the same thing, which is PPE for everybody, not just us, but nurses, everybody that's on this front line so that they're safe. And then over and over and over is, where is the testing?
Yeah. So if you look on the AMA website, I think they always have these signature pages where add your signature as a doc. And when they deliver 50,000, 100,000 physician signatures to a state legislator or
Congress, I mean, that's the lobbying body.
Yeah. I think it holds a lot of weight. And, I'm not an expert in supply chain management. I'm an expert in seeing that there's something wrong with it.
Yeah.
But what is the exact answer? To me, that it'd kind of be like an intern going, I think there's something wrong with this patient. Who do I talk to? And to me, the answer is the AMA, and if the group that I think is probably best positioned to do it well is the military, like we talked about. And I feel like if the private sector can't get it together quickly, that's where we need to look.
Tell me what that would look like with the military. I don't know that in this case what that means.
I mean, I think them working maybe with the CDC and being the centralized source of information for the private sector when it comes to testing and personal protective equipment, keeping things simple. I think there's value to that. And to me, FedEx, let's take a step back. FedEx and UPS are extremely effective at distributing their packages because they do it a certain way. When they started out, they had one hub. Everything flew out from one place.
Wasn't it Nashville or something?
I think for one of them it was Texas. Maybe the other one was Nashville. I don't know. But every package flew to one place, and then it flew out of that one place. Yeah. And so they were very effective at saying, okay, this is our hub of distribution.
Yeah.
We're getting all these packages from all over the world. If it's going to be sent anywhere in the U.S., it comes here. And then now I think they have 2 or 3 places. Everything comes to one spot, and then they figure out where is it supposed to go. They get it to go out at the same time or in a very efficient manner, and they can get things across the country in a day because they've done it that way. If they had one single voice saying, hey, UPS or FedEx or whoever it's going to be, or Amazon, we are going to have you distribute things. This is where these things are needed. So everybody who's making masks, those masks need to go to one of these 5 places in the country. And from there, these places are going to put them out based on what one central person says they need to do, where they need to go. So to me, that's what makes sense.
I feel like throwing Jeff Bezos $1 billion and being like, hey, buddy, fix this problem. I feel like he'd be way better than the post office, you know?
Yeah, maybe Bezos, but somebody, who has experience in this kind of thing, there should be one entity in charge of distributing those things.
Let me ask you kind of a totally different question. What do you say to the average person who maybe doesn't see this in their life? They kind of, the people around them are not sick. They look out the window, everything looks fine and normal. They're just kind of living life at home now. But they're freaked out and afraid and all of this stuff, reading headlines and stuff in the media. It's just hard not to get stressed out, on edge, and anxious. Like, what do you say to the average person who's kind of feeling afraid about this thing?
It's going to be all right. I mean, one way or another, as a society, we're going to get through it. And we're going to come out on the other end of it. That is going to happen. There may be some painful periods and there may be a small number of people who are not okay, but by and large, the vast majority of people are going to be okay on the other side of this. That's my sincere belief. The more systematic and science-based our approach is, I think, then the smaller the number of people who are who have a bad outcome. I think that number gets smaller and smaller. But even if it's complete chaos for 4 months, most young, healthy people are going to come through this. Maybe they need to spend some time on their psychiatrist's couch after it or something like that. But
no kidding.
Yeah. But I think we're going to get through it, and it's what do you do with it when it's all over?
What do you think about these, from a public health standpoint, the social distancing and the home quarantine? Do you think that's appropriate? Do you think it's too extreme? At what point? Do you think by Easter we're going to be lifting things and going back to business? What do you think about that approach?
It's a shotgun approach. It's the logistically easiest approach for our leaders to communicate. I think it's okay. It flattens the curve, that curve that everyone talks about. It flattens the curve, but then if we don't follow that with testing, you don't know if the virus is out there, if you're susceptible, how much of your community is susceptible.
See, that's what I think too. Just doesn't. So, it just by itself, it just doesn't make sense. Like it just seems to only be a part of the picture, and then it's going to paint you into this corner where it's like, well, at what point are you going to take it off? At what point are you going to back off? If you don't have really good testing, you're not going to know if you're going down and if there's less cases because you didn't know in the beginning when they were really going up.
Well, yeah, and at this point, I mean, you look at what's happening in New York. A week from now, it's going to be too late to test half those people because they're not going to have active virus. And the only way to test them is to see if they have antibodies. So 2 weeks from now, if New York is starting, if they feel like they've hit their peak and they're identifying their peak because of how many people are on ventilators and how many people have died, and it's fewer people now than it was last week, but you don't know why.
Yeah.
You don't if it's just certain people who are susceptible have managed to hole up in their house and not touch anything outside of their house for 2 or 3 weeks, and then those people go out and then they get it. So that there might be additional little spikes that happen, but you're never going to know if you don't test. And that, I mean, you look at South Korea and you look at Germany and what they've done, and even Hong Kong, even though they're having their second set of spikes, but they did meticulous, painstaking contact tracing. When someone got the virus, when someone was sick with that virus, not only did they get tested, but they were looking at who have you been in contact with, what kind of contact, all of those close contacts. They were making sure every one of them isolated.
Yeah.
And we're testing them. I don't know how ubiquitously they tested them, but it was pretty liberal. And they're able to cluster it, and they're able to isolate it and keep it sequestered in certain geographic spaces. But you have to do the contact tracing, you have to do the testing.
Yeah, it's like we kind of gave up on that approach and said, no, we're not going to try to just, we're going to quarantine everything, and that's going to take care of all of it. And then we don't have to test as much. I think that was like the mentality, and I just find
I don't think they weren't looking at the end game with that, because you don't know when you can come out again. And I think they were hoping that countries would show, okay, this is what happens, and maybe a cure would be developed, and they'd get a sense of, okay, this is what we can expect, and maybe piggyback off of the experience of other countries.
Yeah.
But the problem is you've got two distinct experiences in countries. You've got the countries who contain it really well because they've done the hard work and the painstaking work, and the countries and the places where it's out of control because they didn't. In my opinion, it's because they didn't.
Yeah. So I keep coming back to this. Even in a scenario here where we're not, maybe we aren't executing, the best, data-driven, high-testing approach to this thing, we're still going to survive. This isn't the viral apocalypse, but it's going to be rougher than it had to be.
Yeah, that's basically what it comes down to. It's just going to be rougher than it had to be. It's like the Three Little Piggies, right? That we teach our kids. How do you build your house? Like, do you have a system that's ready for something like this, that's truly ready for something like this? Or are you just talking the talk that you're ready for something like this as a society?
Yeah, I again, we've talked kind of a lot about messaging and what is the message, and I don't think the message is, oh my God, we're not prepared, freak out. It's still like, no, we are going to get through this. Parts of it are going to suck, and it could have been better. Vote accordingly, etc.
Yeah.
But I remember reading seeing this post of Tim Ferriss where he posted a text he got from a doctor in New York that was just panicking and freaking out. And on the one hand, I understand the feelings of overwhelm and just working in a system where there's a lot of sick people and you don't feel like you have enough stuff. But then on the other hand, I was like, when I go to the ER and I'm like, like shoulder to shoulder with these nurses, and like, it's just another day at the office. Like, people forget, like, we see crazy shit every day. And yeah, it's dialed up. There is some anxiety in the air and that kind of thing, but that's what we do. You know what I mean? Like, there'll be moments of whatever, and we're going to do our best in the system we have, and we're going to expand capacity as we can. And I've saved my little N95 masks. If they run out, I got one that I can use. Like, we're going to survive. This isn't, and so I've like tried to give a message of, guys, this is not the viral apocalypse. Like, we're going to get through this. We are going to survive as humanity, and it's both and. It's going to be rough for a while. Like, you really do need to stay home. It matters. You got to do your part. Like, that's a meaningful thing. But don't freak out. So, I don't know.
Yeah, no, I agree completely. And one of the biggest hopes I have at the other side of this, this painful experience that everyone is going to be going through, what do we do at the end of it? do we really push for systems that are going to be prepared? Because it's not the last. It's not the last pandemic that's going to happen. It's not the last thing that's going to affect this country or this world.
I mean, I think the easy answer to that is, when SARS went through Asia 2002-3, they learned. They went through, and a lot of those countries, Singapore, etc., South Korea, they were ready. They had a system in place. I think we're going to do something to be prepared for this again. There's just too much political will. That's easy. But the real question that you're asking under there is, like, are we finally going to have some kind of universal health care that would be a big step in addressing so many of the problems that we've had, that this pandemic hitting the United States has really exposed? Is that going to be something that people are willing to advance and pay for a little bit more? Or is it just going to go back to business politics as usual in capitalist America? It's a great question.
It's a big question, right?
I think part of it's going to come from the outcome. So let me ask you this, and this is like, I don't know if you believe, I'm not a conspiracy theorist, but the more that I'm just, it's like I wonder, are we intentionally trying to stuff down the number of cases in an election year so somebody doesn't look bad having not acted early on? And are there other entities that are involved in this? One of my friends who's a dermatologist in Colorado works for Kaiser, and they got this tent, and they stuff all the nurses and doctors in this coronavirus tent where they're doing testing and so forth. They can't leave the tent during the day. They can't get tested unless they get sick. And I'm like, that just doesn't make sense to me. Like, why wouldn't we get tested? And so just like hearing doctors, like I've seen so many CNN articles that are like, well, a doctor talked to us anonymously because they didn't want to get fired for speaking the truth. And I've just been like, this thing is starting to look like a conspiracy. Like, if we keep the numbers artificially low and we're not testing, even though it seems to be the right thing to, like, you and me, somehow there's a benefit to the systems in power, to politicians, to whatever. I don't know. Am I crazy?
Well, I like
it's a conspiracy, Jessica.
I have a friend who's heavy into those kinds of things, and just because you're paranoid doesn't mean they're not trying to get you, but you may be paranoid.
Let me say that again. Just because I'm paranoid doesn't mean they're not trying to get me. That's a good line.
Yeah. So, the only thing that kind of gives me a little comfort when those kinds of ideas surface is, in my opinion, I have never I've never seen a system or met a person organized enough to carry out something on that kind of scale. I just don't imagine that there's an entity that's not already rich enough to do whatever they want that could actually pull something like that off on a grand scale.
I don't know. I started a couple days ago. I started seeing this stuff where it's like pictures of people in their 80s, and they're like, "I'm willing to take one for the economy," and I'm just like, "That was who came up with that idea? This is a terrible idea. Like, these guys are going to war for no. Like, these are people we should be saving. Like, where?" And then that's what I'm like. It's all part of the conspiracy, but. Maybe I'm losing my mind a little bit.
These night shifts with the corona and everything else happening around, you would not be alone. You would not be alone in having some dark thoughts.
You watch, it's going to come out. There's a huge...
In 30 years. In 30 years, there'll be a book about it, and they'll give you a redacted version of the of the official files, and we can refer back to this conversation.
What else should we talk about? Other things that you wanted to get to? How are you? This has been a great conversation, by the way. Thank you for doing this and sharing your knowledge. I've learned many things from you in this conversation already. It's been good. been really good.
Pleasure. No, this is great. Being able to just kind of talk some of this through, even though we're all in relative safety and just kind of waiting it out, seeing what's going to happen.
Yeah.
No, I think there's that medical, clinical, public health, population side of things, and then there's the how do you get through your day on a daily basis, especially all these folks working from home and then having to homeschool their kids against their will.
Oh my gosh.
Against their will, meaning against our will as parents and against kids, and it still has to get done because obviously people have enough hope for the future that they're actually educating their kids.
I saw a comedian that was like, do you know how there's going to be a whole generation of kids that can't read or write because they're going to have to learn this from their parents, and their parents can't read or write. We're screwed.
And it was interesting because my son's part of LAUSD, so they've given us more updates over the last 3 weeks than I would have ever expected or wanted necessarily.
Yeah.
But it's good information, right? So you could see it coming. You knew, okay, in case we have to close the school, and they're calling everybody and sending emails every day saying, in case we have to close the school.
It's a warning shot.
Yeah, it's a shot across the bow. Like, okay, they're going to be closing the school. So they just don't want to say it yet. And one of the things they were trying to do was figure out how to take care of those kids who depended on school for a safe place during the day and for food.
Food. That was the other thing I heard about in Oakland. Like, they deliberated on that so long because there were thousands that's how they ate.
Yeah. Yeah. No, it's an interesting story, too, that this food program in California, the Black Panthers up in Oakland, they started that food program. And the FBI actually considered it one of the biggest threats to America was the Black Panther food program that was in existence back then, right? And so we all know what happened with the Black Panther Party and the other parties that caught the attention of the FBI and so forth that didn't go on. But one of the great things that ended up happening from that is the school systems offered food because they took a note from that group, realizing if kids can't eat, they can't learn. And kids need to be able to eat to go on. So schools have been providing food for kids for decades now. And I think in 1 week, LAUSD said they provided over 250,000 meals to kids and were the single biggest source of food distribution in the country.
Wow.
Yeah.
I didn't realize that. And so what are these guys doing now?
They have 60 centers set up. LAUSD, the Los Angeles Unified School District, 60 centers set up, and kids can take 2 meals a day. They can just show up and they're handed these 2 meals. They take them home.
Oh, okay. So they still go out and get them. Good.
Yeah.
So that's so many, consequences and problems and costs of trying to do the right thing to save lives. I mean, it's overwhelming.
Yeah, lots of downstream effects, and then one silver lining of this inadvertent homeschooling experiment that's now happened is maybe school should be different than it is. I think people haven't wanted to change the way school exists because this is how it's been, and it generally seems to work for most people under the bell curve. One way or another, they get through. And seeing how my son's education has gone the last few years, my own personal experience in the school systems, I think maybe there's a different way, a way that it can be tailored to individuals in a way that is more makes better use of time.
There's certainly this is kind of not only people working from home, homeschooling. I hope in medicine this is a push for more telemedicine. It's like, well, don't go to your doctor if you don't have to. It's not very well reimbursed, but maybe this will be an added kind of push to use more technology to improve the system.
Absolutely. And I've been reading these articles that health insurance and these groups, they don't reimburse for telemedicine and so forth. And I think they leave out a big piece of the picture, which is when you look at, like, California is the state I understand the best. 1/3 of the state of California is currently covered by Medi-Cal. meaning that they're within some percentage of poverty, right? And a good another percentage is covered through employer health coverage.
Medi-Cal being the state Medicaid or insurance for low income.
Exactly. 85% of those Medi-Cal, California Medicaid patients are on a managed care program, and their care gets pushed from the state to an insurance company that then pushes it down to a group such as mine, like Regal, and there's several others. And the way it ends up translating down to the primary care doctor is the primary care doctor gets a capitated rate for the vast majority of their patients. They are charged with keeping them well in whatever way makes sense, whether they see them or they don't see them. So the idea that the insurance companies are somehow preventing telemedicine because of their reimbursement rates, that really only applies to PPO patients, fee-for-service patients. And they can negotiate rates to address that. That can be negotiated. You might need a big physician group to bust through the door in the first place to negotiate that. But for all of those HMO patients, all of those capitated patients, there's no reason why those doctors cannot do televisits immediately.
Well, yeah, or if you had an efficient practice, not everybody had to come in. You could do it over the phone, over whatever, and get things done quicker. That gives me hope.
Yeah. So it's there are ways, there are paths forward for people who pay attention, and there's a lot. There's still a lot of docs out there. I deal with this every week in, week out. There are docs out there that are still paper charting, and you can't read it, and nobody knows what they're doing with their patients. So if we getting them off those paper charts, getting things electronic, legible, it's not over.
Slowly moving forward, sometimes at a snail pace.
Yeah, exactly.
That's good. Well, that's good to end on something like that. That's hopeful.
Yeah.
Do you want to give us a conclusion? Just give me a little conclusion minute or two where you're at right now with this whole thing and looking forward. We've certainly had a good conversation about everything from the message right now to that we're going to get through this. It's going to probably be a little bumpy, especially for certain pockets. We're going to learn a lot about public health approaches and probably should be doing more testing. We want to make sure there is PPE. Talk to your organizations, the AMA, your local doctor groups to advocate on that behalf. I think that's a great idea, but that it's going to be okay. And maybe that at the end of this, there'll be some really good things that come out of it, not just the healthcare system, but schools and others too.
Yeah, no, I think you summed it up wonderfully. We will get through it. It will be a bumpy road. Everything touches everything in our world now. So chaos is contagious, but so is doing things well. So if we can get things right in certain areas, it diffuses.
Chaos is contagious, but so is doing everything well. You've got some good one-liners.
Hey, I should patent or copyright some of these.
I'm going to quote you, and I'll tweet that stuff.
Right on.
Hey, this was a lot of fun. This was really good. Thank you for doing this.
That was great, Larry. I'm glad you're doing this, and thanks for inviting me.
Yeah, we should do it again. We'll check in again and see where we're at in a week or two if you're available, and I'm sure by then we would have more to talk about too.
Yeah, that sounds perfect. All right, Jackson, you want to sign off?
Thank you to your cameraman. I can't wait to see his work in this production, which I am sure will be nothing short of incredible. He's not sure he wants to be on camera, though. That's fair.
All right, Larry. Well, you have a wonderful rest of your afternoon, and let's be in touch.
Sounds good. Thanks, Jessica.
Okay, thanks.
See you, Jackson.
Say bye-bye.
Bye-bye.
Bye, Larry.